in general, like, what do you think are some of the main frustrations about being an older adult with Duchenne muscular dystrophy and kind of wanting to access treatments but them being for younger people? How do you kind of reconcile that?
I mean, the first thing I would say is one of the main frustrations I have is actually access to basic care. It's very much a postcode lottery as to where you live and which muscle centres you have access to, because from what I understand, some muscle centres are better than others, at doing that, and in terms of what they provide in terms of the other things that people with DMD need, with cardiac issues and dealing with respiratory issues, and if you get good respiratory care, you can prevent chest infections from getting too bad, or which ultimately is what is the things that are most life-threatening to people with the condition.
Well, I think that's something that, not just to focus on treatments and
exactly
in the form of scientific kind of medicines, is that actually there should be just as much focus on things like physiotherapy.
Well, certainly. I mean, a lot of these drugs are only coming online now, so we don't actually know what the long-term effect of them is going to be. Mm-hmm. But the fact that people are living longer already suggests that the basic care needs are ultimately half of the battle in the first place. Because if you can maintain the breathing for longer, if you can maintain the standing for longer, or whatever it is, it's the actual care that goes alongside that is essential, really.
Absolutely. And in terms of you seeing young children being on these trials and then the drugs only being approved for young children, and possibly looking as an older adult with Duchenne muscular dystrophy and thinking, could they help me? Is there frustration there, or do you have to kind of try and understand it?
I mean, I personally don't find it that frustrating, because you have to start somewhere, and if it's with those people where it can have a more dramatic effect, then that makes sense. I mean, I think it should definitely be looked into in terms of spreading access out for people that bit older, even if it can have a small effect, because obviously everything is it's all worthwhile. But I can understand why it would have to start at the younger ages. But it's in terms of, I think it should be rolled out for a bigger group of people as soon as the data suggests that it'll have an effect. I mean, because obviously you don't want to wait until we've only I think it would be unfair to only start with the younger people and follow that generation through and not do anything about the older generation. But I understand why they have to start with the younger group of people, but it would then be about making a decision about spreading it out further. And I think that's very much what I said, that you start with a smaller group and then you assess it in terms of what the benefit might be for a larger group of people with the condition.
Yeah, no, absolutely. About getting faster access, not just access, but making sure that's as fast as possible in terms of the turnaround after we can see the results and the improvement. Brilliant. Thanks, Joshua.
You're welcome.